So, is there anything new in your life?
No, not at all. How about you? I noticed you're wearing a mask. Are you sick or something?
I can see so. You see, like 2 weeks ago, I went jogging with my friend.
Have you considered visiting a doctor?
Not really. I don't really thought about this a big deal.
But what if is it? You should consider getting an appointment soon.
Do you think so?
Yeah, of course. I'm going to check myself next week. You should come with me, and so I will not feel like alone. And I know the doctor. He's a really good friend of mine. He will attend us with a really reasonable price.
So, I listened to my friend and I went to the doctor.
And what were you and your friend diagnosed with?
You won't believe it.
So you're saying that your symptoms are persistent and heavy coughing, chest pain, exhaustion with no apparent reason, and breathing difficulties?
Yes, doctor.
Well, are you at constant exposure to inhaling toxic substances or microparticles?
Well, I work as a manicurist and I don't tend to use face mask or type of protection.
Well, I'm going to need some analysis to determine the exact cause of your ailing. What I can tell you right now is that you are suffering from a chronic disease and that is very likely not to have a cure.
Doctor, we have another patient with possible lung cancer. Okay, tell them to come in. Melanie Mendoza, the doctor is waiting for you. Good afternoon. You're Magali, right? Yeah. Okay. Well, I need you to take off your jewelry and your clothes and put this down on. Okay. You're going to position yourself into the metallic face position like this, and you're going to press your chest against it. Are you ready for it? The result is going to take between 3 and 4 days to come. Okay.
Was it painful when you got your radiography?
Not at all, but it was a little awkward.
And what about your final diagnosis? Why were you prescribed to use a face mask?
The use of a mask is more like a recommendation. The real diagnosis was more like...
Andrea Castillo? Yes? I'm sorry to tell you that we found a small carcinogenic tumor located near one of your respiratory ways. At this point, they usually produce symptoms. You were lucky to be diagnosed at an early stage. Don't worry, since you are barely at first phase, it is very likely to be cured through extirpation, but you will need constant monitoring.
I'm so sorry to hear that. I hope that you get better very soon.
Thank you. The hospital has booked surgery appointment for me next month.
I'm glad to hear that. You should take a break from all this new chemical stuff.
That's what she said. This is going to be my last week working in a way.
Good for you.